My name is Katherine Catalano. I'm the Deputy Director of the Center for Climate, Health, and Equity at the American Public Health Association, and I am so pleased to welcome Natasha Sood, co-founder of Medical Students for a Sustainable Future. Hi, Natasha.
Hello. Thank you so much, Katherine, for the introduction. I am very excited to be here. Thank you to everyone at the American Climate Leadership Summit for organizing this incredibly important conference, and for all the speakers today. It has truly been very inspiring.
Yes, it definitely has. We have some time here to talk about your experiences. I'd love to dive in. 3 years ago, you co-founded Medical Students for a Sustainable Future to provide medical students with the tools they need to make a difference at their institutions and in their communities to address climate change. I'd love to hear more about your background. What was your experience with climate action and advocacy before this, and what inspired you to step into this leadership role?
Absolutely. So climate and environmental issues have always been very important to me. I think it really began when I was very little. I think middle school, I was at my local public library, and I came across some of Dr. Jane Goodall's work in conservation and her intense study of the social interactions of chimpanzee family circles. And just reading through her work, it really primed me on this concept of relationships, those that we have with our own family members, with our community, and the relationship that we have with our environment, and how much we truly depend on it, both in the human world and in the animal world, and the natural resources that it really allows us and affords us to build our economies, our systems, and how much we depend on it for our livelihoods and for our health. So this early exposure to her work, it really inspired me to study the relationship between environment and health more formally in college and graduate school. And the more that I learned about it, the more that it became very clear to me that climate change impacts not just public health, but clinical medicine, both directly and indirectly, as we've heard about today, at the individual and community level, but also the ways that it impacts the functioning of health systems and frontline workers, as we've seen during the COVID-19 pandemic. So when I started medical school in 2018, it suddenly dawned on me very early on that in medical school, we were not learning about how climate change was impacting the health of our patients and our communities, and what that meant for our role as rising clinicians in providing care in the context of our changing climate. So during my first year of medical school, I started to learn a little bit more about health curriculum and how to incorporate climate change into health. And at that point, I was connected with Dr. Amy Collins at Healthcare Without Harm, and she had been in contact with several other medical students around the country who were doing the same at their medical schools in the climate and health curricular space. And eventually we all got in touch with now Dr. Harleen Marwa. She's the founder of MS4SF and current pediatrics resident. And from that very small group, we quickly grew into a dozen, 20, 30, and now 3 years later, we are a grassroots organization of over 600 medical students across the country who are committed to taking action on climate and health justice. And I don't think any of us really expected the rapid growth and engagement that we received, but we really feel that it is a reflection on the understanding amongst health professional students that climate change is an urgent issue for healthcare and something that we actively want to learn about in our education.
Great. And just for folks listening, because we might keep using the shorthand, MS4SF, Medical Students for a Sustainable Future. Just always good
at first.
Yeah, always. Great. Okay, so I mean, to follow on that, as a medical student yourself, I'm sure your workload was top of mind when considering this undertaking and helping co-found this group. How did you find the time to stay so engaged on climate issues? And how are you able to motivate and mobilize so many other busy medical students?
This is a really good question, but the first I'd say is teamwork. I think the growth and the dedication and the activism of MS4SF is a reflection of the many, many, many medical students working together to create a movement within the health field to address climate change. And I think our passion and commitment to science in this work is what is really contagious. And so because of that, we are constantly welcoming new members and working on new projects to engage not only our co-medical students and colleagues, but also our local health systems, system leaders, local politicians, and most importantly, our patients. And our commitment to this work really rests on the fact that so much of an individual's health is determined outside the clinical setting. Again, as we've heard today, we know that medical treatments are far less effective when social and environmental determinants of health are compromised. And so it's really critical that we ensure that our patients have access to clean air, water, healthy food, housing, because through acute and chronic crises, climate change exacerbates these inequities. And we know that the impacts of climate change, whether it's heat or air pollution, disasters, infectious disease outbreaks, they all disproportionately impact low-income communities of color and historically marginalized populations. And as medical students, as rising clinicians, we strongly believe that it is our responsibility to advocate for those who do not always have a seat at the table. And the connection between climate and health is so critical. And it's such a powerful tool for opening doors and dialogue and even solutions. And to answer the second part of your question, I don't think any of us think of our work in climate to be separate from our work in health and from our role as medical students and rising physicians. In fact, we think they're inextricably linked. And we believe that our work as physicians is to advocate for our patients, both inside and outside the four walls of the hospital. And so for that reason, I think we will always find the time to ensure the best possible health outcomes for our patients.
It really is inspiring to hear about the passion and dedication that's so foundational to your group and to the advocates that you've worked with. I've had several opportunities to work with student groups over the years, and I'm always so impressed with their energy around these issues, even when many of them have jobs on top of class and are trying to do everything they can to prepare themselves for their careers. That's a lot on one person's plate, you know, even when we know these issues are so urgent. And we have to work on them and we have to focus on them. I think it's important for the folks watching today, those of us who are dedicated to building coalitions and building power for this movement, to think about how we can all help inspire more student advocates and to consider what kinds of materials and guidance we can offer to make engagement that much more manageable for them so that they can continue to provide thought leadership and energy and passion without asking them to burn themselves out, frankly.
Absolutely. I think in this work, both as an individual, but also as a member of an organization, it's so critical to consider individual and group bandwidth in whatever space you are working in. And at MS4SF, we quickly realized that our student leaders have different bandwidths, they have different time capacities, and different passions within the climate and health space. And so we wanted to provide a space for each of them to explore their own interests. So we had several different work streams, whether it's advocacy and policy, or research and education and curriculum reform, and even climate smart healthcare and sustainability, so that students can plug in different areas. But to go back to the point that you bring up about bandwidth and burnout, we know that everyone has different capacities to plug in. And Harleen had created this really, what I think is an incredible strategy, is we tried to organize all of our projects with three main sort of points of engagement. So an individual could join as a learner, where they wanted to learn more about the topic, but that was all that they had the space or capacity for. Or number two, they could join as an engager, where the individual found that they care strongly about the issue and they have time and bandwidth to get involved. And number three, there was an opportunity for them to join as an organizer. They wanted to lead and create opportunities for others to make change. And at MS4SF, I think that's been really critical to making sure that we all feel that we are not burnt out and that we can continue to come back every day and contribute to this work. Because individuals plugging it on any one of those levels is really important. In terms of burnout, though, I will say that it is a continuous learning process, and strongly recommend that students evaluate their commitments and make sure that they're working with people who uplift them in case they do need to step back and circle back at another time.
Great. I love how that framework was really spelled out, and those menu of options was given as far as levels of engagement. I think that's brilliant. Very cool. Okay. Well, as you were saying, at whatever level of commitment folks can give or level of time, we all recognize that climate change is an urgent threat to both human health and social justice. And student and youth activists seem to be grasping that urgency more than any other generation as they face the effects of a climate crisis that is very much already here and impacts even more of their future. It's exciting to see such passionate young activists influencing the global conversation on climate, but we can't forget that this increase in action stems from feelings of anger and fear and often betrayal by leaders who don't seem to be listening. So fighting for your own future takes a mental health toll. That's really it. And, according to a 2020 poll by the Washington Post and the Kaiser Family Foundation, only 29% of youth were optimistic for the future in regards to climate change. What can we all do to better address and ease this mental health burden on young people and young advocates today?
This is so important, and I think it's so challenging. Like you said, working in this field and working towards any issue that you're passionate about, it can be very overwhelming at times. I've certainly felt it the last couple of years, especially with what is at stake. And especially with the urgency and the science behind it. And I think through MS4SF, I've found that working with engaging and supportive colleagues is critical, and it has been most important for me to keep coming back. I'm constantly inspired and motivated by my classmates, co-MS4SF members, and mentors, many of whom have spoken at this conference. And I think that the progress is slow, but it is still progress, and we have to keep forging ahead because there's no other way around.
Great. Well, I know we're almost out of time here. I do want to, bring up the title for our talk together today, which is Onwards for Climate and Health, which feels sort of like a battle cry to rally the troops of climate warriors, but we're fighting for better and more just health outcomes in the face of this crisis. But amongst all these feelings of anger and fear and betrayal and those things we were talking about, it can be hard to keep fighting without reminders of hope and the belief that we can make a difference. How have you been able to find hope to power your activism?
This is really important to me. And I think that one of the greatest privileges of working and studying in medicine is that we are our patients' storytellers. We listen to our patients' experiences, and we have the opportunity to work with them to hopefully achieve better health outcomes. And this process is incredibly humbling. Each patient, each community member, each colleague that we listen to are each a reminder as to why we are doing the work that we do. They are the beacons of hope, and their struggles, their successes are the reasons why we are advocating for a better future, whether it be through research or advocacy, through clinical medicine and public health. We are working towards creating a future that is centered on justice and equity and sustainability. And I think that as any advocate, the most powerful thing that you can do is listen to the experiences, the struggles, the hopes, and the fears of those in your community, and use whatever platform you have to uplift their voices, and ultimately use that energy to guide your activism. And as Harleen says, that is the most renewable source of energy.
Oh, I love that. Well, thank you so much. Unfortunately, that's all the time we have for today, but I'm very sure that we'll continue hearing more from you, Natasha, as you continue on your medical career and your climate health and equity advocacy. So thanks so much for speaking with me today.